That's a great question, actually.
And it depends.
and it does depend. So for drug-drug interactions, I go to Micromedics every time. I find their drug-drug interaction section to be the best. And then their pharmacokinetic information is far better as well, because you can click on they have a detailed summary, which gives you far more information than you ever knew that you wanted to know. So I prefer Micromedics for deeper knowledge, deeper basic knowledge, if that makes any sense. But otherwise, I start with LexiComp.
See, and I would say I use clinical pharmacology's drug interactions because most of the time it'll actually tell you how much it's going to change by. So if you have a CYP450 drug interaction, it'll say the AUC increases by 70%, dose adjust by this amount. So I find that to be useful for me over Micromedics. But Micromedics, I would agree with Dr. Barber that the PK section of it is very, very detailed when you click on the in detail section. I like to use LexiComp for pricing. If I'm going to recommend a drug for a patient to go home on that, for a patient that does not have insurance, I'm going to look up LexiComp to see what is the cash price for this drug to say, maybe we should pick another one that might be a little bit cheaper. Clinical pharmacology is very detailed in its side effects. It will give you the primary list resources and references behind all of the side effects that are mentioned, as well as summarize them. So that's where I like going to ClinPharm for understanding more about the side effects.
And mine depends on, am I in the hospital on rounds and using my phone to look up something, or am I on my computer? I love LexiComp on my phone. It's quick, it's easy, I can get my dosing, I can look up general adverse effects, pretty much anything my team needs to know right then and there. If I'm at my computer, I have Micromedics saved, it's easy to use, friendly, you get the in-depth answers if you need. You can also look up other things. I don't use clinical pharmacology so much just because I can usually find everything I need between LexiComp and Micromedics.